means to stand by it and get all the good there is in it, it is a serious matter, and should be considered as seriously as the subject of picking out a girl for a wife, or as seriously as he would say his prayers if he were going to be hung. If he goes at it in this way, he will not go far until he learns that there are 10,000 chambers in the human body that have never been intelligently explored. He can jump over a great deal if he wants to. A man can learn his ABCs and the winding up of the Greek verb. He has jumped. So just so in studying anatomy, a man can jump, and when he comes out here and tells you that he thoroughly understands all this science of osteopathy, even a respectable quantity, in less than 2 years, he jumps a little. We have been placed in a peculiar position. So many people are suffering, and there is nothing at home but drugs and blisters, and they are begging for our juveniles. They will make them enticing offers and ask us to let them go. Previous to the commencement of this class, we tried to accommodate the people as best as we could. But I tell you, the philosopher is born after 24 months. No 9 months gestation will give you an osteopath. It must be after a gestation of 2 years, and then they are only beginners. Even here, whereas Professor Blitz of London, England, says we have the greatest clinical advantages on the face of the earth, the greatest facilities for comprehending anatomy, even though that is the case at the end of 2 years, our very best and most competent operators would like for me to carry the load, as the young man who gives Dad the heaviest end of the log because the skin on his shoulder is tough. We control all the fevers of this or any other climate, all of the contagious diseases such as mumps, chickenpox, scarlet fever, measles, diphtheria, or whooping cough, also flux, constipation, diseases of the kidney and of the spine. We deal with the brain, the liver, the lungs, and the heart. In short, every division of the whole human body with all its parts. I can take a young man in here for a little while and make an imitator of him and send him out so he can handle diphtheria or croup in 7 cases out of 10, and he can handle some headaches. What is the condition? He is like my Polly. Polly wants a cracker and don't know what he is saying or doing. You ask him where the glossopharyngeal nerve is, and he will say he don't remember. He will look in his book for it. We want you to thoroughly understand anatomy so that it will come to you as quick as ouches to a Dutchman's mouth when he gets his finger hurt. It ought to be second nature. It should be as indelibly fixed as passing the hat is on the minister's mind, a duty not to be omitted before he closes. Since the school was incorporated, we have established such rules as we think necessary to the attainment of a thorough knowledge of anatomy. First you have anatomy, and that is a great book. After you have mastered it, you take physiology, which is just twice as much anatomy. Then we have what we call symptomatology. We take up the different symptoms or combination of symptoms. One indicates toothache, another something else. Suppose there has been a stoppage of blood supply of the stomach. What is the result? What we call cancer. Another symptom would indicate pneumonia. What is pneumonia? You take an osteopath that knows his business thoroughly, and he can give you the diagnosis and never use a single term of the old schools. Take scrofula, consumption, eczema, every one of them. There is a broken current, an unfriendly relation existing between the capillaries of the veins and arteries. What is flux? An abortive effort of the artery to feed the vein. The vein contracts and the artery spills the blood at the nearest place, passes through the bowels, and death results. The doctor gives his quinine, kino, his gourd seed, tea, and other poisons, and adds his mustard plasters. The child dies. It is a Baptist child, and they bring him to Brother Morgan, and he says, "Whereas it pleased God to take that child." I don't believe Brother Morgan would say that. He would say, "I believe this death is through the ignorance of the doctor. That child should have lived and worked, as that was God's will." I came here tonight to tell you that the science of osteopathy, as little as is known of it now, bids fair in very few years to penetrate the minds of the philosophers of the whole world, whether they speak English or not. Today it is known not only by the English nations of the world, but it is known in Germany, it is known in France, possibly not so well known as the cyclone in St. Louis, but like that cyclone commencing there and working all over the country, this cyclone will show itself in the legislators inside of a very few years. Intelligent men, competent to investigate a science and honest enough to tell the truth when they have investigated, cannot fail to see the results of osteopathy. They see osteopathy coming home with the scalps of measles, mumps, flux, diphtheria, scarlet fever, whooping cough, and croup under its arm. The philosopher has discovered that nature has the ability to construct a machine that is trustworthy over all climates. Here is a man living at New Orleans. It takes not breath for him. It does not take much for him to breathe down there. He breathes once in a while and gets along all right. He goes farther north and finds himself at 72 degrees or 73 north latitude. What does he find? He breathes faster, his lungs are stronger, and the heart dispenses a larger quantity of electricity. That throws the electric current much faster, and it keeps him warmer in the colder weather. Pick the man up and drop him in New Orleans, and you would have to put him in water to keep him cool. He would be warmer because his lungs are increasing the action of electricity. I picked up a chicken today that had not a feather on its back. It was just ready for the preacher. What was the motion of that chicken's heart? It must have been 180, maybe 280. Why was the heart running at such a velocity as that? To keep that chicken warm until the feathers came out. At every stroke of the master architect of the universe, you will see the proof of intelligence, and his work is absolute. I wish to speak of the abilities of our operators to judge as to your case. They have studied anatomy and physiology to completion. Then they were placed in the operating rooms after having passed through the training in the clinics. They are skilled operators and know by experience when they are turning a button or on or off, and have handled 15 or 20,000 cases, about the number of patients who visit here annually. If there is anything one of them does not comprehend, it goes direct to the next one above, and if they all get puzzled, they come and ask me, and I go to guessing. When you come here, go in there and call out an investigation before the operators and talk to them as though you considered they had some intelligence and some sense, and don't stand there and say you want the old doctor. The old doctor is not going to do this work if you pick up and go home. When a man has worked and built up a science like this and has spent 20 years in doing it, if he has failed to impart that knowledge, he should quit. I have men here who know their business, and I simply ask you to treat them with respect until they have examined your case. Once in a while there is a very dangerous case where a person is between life and death, and they come to me about it, and I look at it. I can't set every toe, elbow, or joint of the 20,000 who annually come here. When you are talking to a graduate of this school, you are talking to a man who knows a great deal about the body, and his conclusions are correct. There are some who think they know more about our business after they have been in the house 5 minutes than those who have been here 5 years. I am within a few days of 68, and I shall put in the rest of my days preaching here. I am glad to meet you on the street and have a friendly chat, but when you want to talk about your case, go and see the secretary. I believe I can teach this science to others, or I should quit. I dragged 10 years' miserable existence working too hard when there was no use of it. I have put in tens of thousands of dollars here to demonstrate to you that I can teach it, and that men do know it. I do not go over the town at the birth of every child. The people send for one of the operators, expect results, and they will get them. I don't want people tapping on the windows for me to stop and examine them after such men as Dr. Hildreth and Dr. Patterson or others have passed on their cases. I am willing to stop on the porches and talk with you and have a good time, but I don't want to examine you. I know you can have it done better here. You come here an old skeleton with but little meat on it, and sneak in as if you were ashamed to come. You are ashamed to come, and many of you don't let your husbands know it. That is your side of it. What have you had? You have had the surgeon's knife lacerate your body and some leading nerve of the body cut out. You come here and expect us what? To make a man or woman out of you after you have been slashed up as if you had a fight in Russia with 3 wild boars? The hamstrings are cut. Can you make a leg out of it? Can you make an arm when the subclavian artery is cut? 9 out of 10 who come here for treatment have tried everything else. They say they are hopeless, but I don't believe a word of that, or they would not come here. Many have been operated upon. They have goiter and have been treated by the knife, the thyroid artery cut, the hypodermic syringe, acid, and poisons used. We don't want that kind of a case because the arteries that supply the part have been destroyed. We have less material to work with than we want. You come here loaded with digitalis, what for? Why, on account of heart trouble. What do we find? We find a heart probably longer than it ought to be, or too wide. I caution my operators in such cases not to deal with that set of nerves so as to throw too great a force on the heart, but let it on easy, I say to them. Boys, don't flatter any man, woman, or child who comes here. Tell them there is some hope. 2 to 4 weeks will show what chance there is for them. I don't want the patients to say, Dr. Landis would not give me any assurance about it. He is not going to do it and stay with me. Dr. Patterson or Dr. Charlie, my son, will not give you any flattery. If they can give you a ray of hope, they will do so. You come here with what you call aneurysm of any great vessel leading to the heart. Suppose Dr. Charlie examines that heart. He hears a rasping sound. He asks you who said it was an aneurysm. You answer Dr. Neely, or else say Dr. Mudge or Fudge of St. Louis or some other place. There is a rasping, roaring sound. You can easily hear it. Aneurysm, what is that? Dr. Charlie still, what do you find there? He says to the patient, when did you first notice that? A horse scared by a pig threw me off, and then my heart made the noise. How long afterwards? 2 minutes. Dr. Smith, how long does it take to make aneurysm on an artery? Answer, weeks or months. And his heart made that noise in 2 minutes after being thrown from his horse. I myself was thrown from a horse and got a jolt, and that set my heart tooting, and they told me it was valvular disturbance. That noise indicated that the phrenic nerve and some muscles are not acting right, and every time the bow or artery is drawn across it, it makes that noise. They go back to Kentucky cured of so-called aneurysm. I think it is useless to talk further as the night is hot, and it takes a great deal of patience to be patient such an evening as this, so I will bid you good night.